Welcome to today's podcast. My name is Burley Brewer, and I will be your host. Today's podcast guest is Dr. Vett Lloyd. Today we're going to talk to Dr. Lloyd about ticks and Lyme disease. Welcome, Dr. Lloyd.
Thank you very much for inviting me.
Over the last year, every time you go on social media, it seems that you're seeing an article dealing with ticks and Lyme disease. And for our listeners, it's a case of some people. It's simply every day they walk their dogs on a trail, perhaps in the forest or on the edge of trees. For a lot of workers in our province, work outside in the summers. People working for utilities, people working for municipalities, and so on. So it's become somewhat of a big issue. So I guess to start with, what are ticks and what does make them such a concern?
Okay, so ticks are small and they look like insects. If you're a biologist and you care about these things, you'll automatically say, but they're not really insects. They're members of the spider family. So they're arachnids. No one else really cares. They're small. They, like many other nasty things, like to live on blood. So they suck the blood out of us. Unlike mosquitoes, they don't fly around, so that's good. They're stealth predators, so they hang out on the vegetation, usually fairly low to the ground. And if someone or something with blood walks by, they will grab onto that person, crawl around rather slowly on their body so that they don't alert their host/meal to their presence, and then shove their barbed mouth parts into their hosts and start sucking blood. They'll do that for about a week, which means the two things. One is they inject an anesthetic, so you don't feel the bite, and also they tend to go into dark, moist cracks and crevices because they don't want to be disturbed for the week that they feed. Now, that's just disgusting, but it's not a health risk in itself. The problem is that ticks will feed multiple times. So when they're small ticks, they will feed on wildlife. And as they're sucking up the blood of wildlife, they will pick up any diseases that are present in the wildlife. Then if they end up on a person or a pet or another animal, the diseases they picked up before, they will put into their new host/blood meal in exchange for the blood. So it's not a great deal for the person or pet or animal donating the blood because you lose blood. Usually that's not too big a deal, but you're getting a trade of whatever bacteria, viruses, worms, parasites were in that tick. They're being pumped into your bloodstream. That's where the problem starts. When we get diseases from animals, they're called zoonotic diseases, and wildlife is able to deal with these diseases. Humans are not necessarily able to deal with it. COVID was a good example of that.
So what makes tick bites different from other outdoor bug bites such as black flies, mosquitoes, and so
on? What makes it different are mosquitoes and various flies. They will take blood, but they don't spend a long time sucking it. So they're just taking your blood. It's fairly rare that they will spend enough time sucking your blood to give you a pathogen, a disease-causing microbe in exchange. There are a few viruses that can be transmitted by mosquito bites and a few parasites, but there are a lot of mosquitoes in the world, so they do cause a lot of disease. Ticks really carry the most different pathogens, and they're quite good at moving them from one animal to another, and we're animals.
So is there any area that ticks particularly would hang out?
Ticks like moisture, and they're not super energetic creatures, so a day in the life of a tick is actually, from our perspective, fairly boring. It will usually, unless it's very humid, it'll overnight in the leaf litter, so it's down just a little bit down in the leaves in the ground. And then its big excitement for the day is to very slowly crawl a few centimeters up a blade of grass or some other vegetation. They'll hang out there. They've got 8 legs like a spider, so they hang on with their back legs. They stick their front legs out, which is actually where they have their equivalent of a nose. It's a little bit strange. And if someone comes by or something with blood comes by, they'll grab on with the front legs. If they don't get some passing animal to give them a ride and a meal, they'll just crawl down and repeat the next day. And they can keep doing this for day after day. And a tick will typically live 2 to 3 years. So they're very patient.
So are you more likely to run into ticks in tall grass or the woods?
It really depends where you are in the habitat. The typical place people think about ticks is on the edge between a forest and tall grass, but you can find them in deep forest and you can find them in grass. They don't particularly care for short grass, and it's not necessarily that the ticks care how long the grass is. The ticks are moved around locally by small rodents and birds. Think about as Uber for ticks. So it's mostly that if you've got a golf course, the rodents just don't find a whole lot of feeding in your well-manicured, well-fertilized, and very short grass. So they'll hang around on the taller grass on the edge. The same is true in fields. So wherever you find rodents, you're likely to find ticks, and there aren't actually that many places that rodents dislike.
Now, a lot of articles I've read talk about that ticks are increasing exponentially every year, and they express a very big concern over this. What's your thoughts on it?
Yeah, there's no question. It's not so much the global population of ticks is increasing, although it probably is slightly, but they are surviving further north. So from our perspective on sort of the northerly chunk of North America, we're seeing hugely more ticks of the dangerous kind than we used to see. There have always been ticks here. They tend to be fairly specific to wildlife. Anyone who's looking at wildlife or hunting will have known that you find ticks on rabbits, for example, and that's a fairly significant problem for the rabbits. But unless you spend a lot of time sticking your arms or your head inside of a rabbit hole, a human wouldn't encounter them. The problem are the ticks that live in sort of mid-range United States. In the past, when they would be brought up here by migrating birds, large animals that travel a long distance, they'd live for a while and then they'd get a good old maritime winter and they'd be covered by snow, and that snow would essentially starve them to death. Less snow now. So they're doing a lot better, and one adult female tick, when she gets a full blood meal, will lay 2,000, 3,000 eggs. So that means you can get a lot of ticks very, very quickly.
So we're used to being able to use different kinds of sprays, for example, when we're going in the woods to deal with mosquitoes and so on. Anything you can use that's commercially available to prevent ticks from attaching themselves?
Yes. There are repellents, and nothing is 100%, but with the commercial products, if they say that they work on ticks, they probably have been tested, so that's a good start. some of them will make life easy for you and have little symbols of a mosquito and a tick. So some of the mosquito repellents will somewhat discourage the ticks. However, ticks they're not as fussy as mosquitoes. If you've got blood, they'll hold their little ticky noses and get through a lot of repellents that would discourage a mosquito. So most of the mosquito sprays, they have added additional chemicals, perethins and perethoids, to further discourage the ticks. One thing that you have to be aware of with ticks is they're lower down, so just spraying your arms will probably not stop a tick from grabbing onto your lower extremities, your lower limbs, your legs. So you want to spray your legs as well, and you want to spray more frequently than you need to keep mosquitoes at bay.
So how do you know you go for a walk in the woods, whether it's for work or to take your dog for a walk? You finish your walk, you come home. You say they live on you. They can live on you for a week. Uh, are you necessarily going to see a tick bite right away or
You will
not?
not see a tick bite right away, but because after you come home from walking your dog, that tick may well still be wandering about your body looking for that ideal niche to settle down and have a good long meal. So you may see the tick. Now, to see the tick, you actually have to look for the tick. They're not going to crawl up to your forehead and plant themselves in the middle of your forehead, usually, because your forehead is a long walk for them, and they want dark and moist. So mostly you have to look in the dark and moist cracks in your body. So, the usual public health messages are very discreet. Look behind the back of your knees. Okay. It's moist perhaps, and it's sort of got a crack, but there are other folds and cracks in your skin on the lower part of your body. That is going to be a place that attracts ticks. So that leads to a tick check. That is really our best defense against ticks. At some point in the day, most people are without clothes for a bit. You're changing clothes, you're having a shower, whatever. It's a very good idea to look at yourself in a mirror, or if you have someone handy who's willing, get them to help. And you're looking in all the dark cracks and crevices for a small black dot. It looks like a freckle, but unlike a freckle, it wasn't there the day before, and it's got legs. Freckles are not supposed to have legs. So if you see one of them, that's a problem. You need to get it off.
Now, before we get into that, will taking a shower get rid of ticks? If you take a hot shower?
If you have a shower and the tick has not started feeding, the water might push it away. They hang on really well. So a shower is not sort of, good, I've had a shower, I'm good to go. It helps, but it's certainly not going to solve the problem. If they have started feeding, their mouth parts are like a little harpoon, and they're driving it into you, which sounds disgusting, but again, it doesn't hurt. And that'll keep them through pretty much anything. A shower, a bath, they're just going to hang on with their mouth parts.
Now, I realize after a few days maybe that I've had a bite. How do I know it's a tick bite, and what do I do?
Okay, so first thing, if you're doing regular tick checks, hopefully you're going to catch the tick quickly. The sooner you get it off you, the less time it's had to give you various diseases. Some diseases, some pathogens, like the bacteria that causes Lyme disease, take a certain amount of time to transfer. How much time depends on a number of situations, but the sooner you get it off you, the better. Other pathogens go really quickly, others go more slowly. So you want to get the tick off as quickly as possible. I can talk about how to get ticks removed if you want to do that?
Yes, sure.
Okay. So there's a lot of mythology about the best way to get a tick off. And everyone has a preferred way. There are some better ideas and some worse ideas. The main thing is to get the tick off you as opposed to, oh, that's interesting, but it doesn't hurt. I'll just leave it and see what happens. Don't think many people would do that. It's in most circumstances, you probably don't need to rush to your nearest ER because that's going to likely lead to a delay in getting the tick off you. So this is something you can do at home. You can do it effectively. You can do it easily. The preferred approach is tweezers, and sharpish tweezers so that you grab close to the skin, lift slowly upwards. It's a little bit alarming because the tick's really stuck in there and your skin's going to come up with it. And you would think this hurts, but it doesn't because the tick injects an anesthetic. Same is true if you're taking it off a dog or a cat. As long as you don't grab huge hunks of hair, they will probably object to that, you can remove the tick without hurting them. There are tools. There are tick twisters, tick lifters, what have you. Some people like them because dealing with ticks just disgusts them, so those work fine. If all else fails and you have no other option, you can probably use your fingers. If you're going to use your fingers, make sure you don't have cuts on those fingers or don't use the fingers with cuts. You do not want to squish a tick into any open wounds because they have all these disease-causing microbes inside of them. So getting the tick off you, good idea. There's some older approaches. You cut the tick off, you burn it off with a match, you put Vaseline on it, you put kerosene on it. I've seen someone saying that you have to put nail polish on it. I don't really know how many people hike through the woods with nail polish, but none of that is optimal because it takes time. Putting kerosene on you, particularly followed by a match, is just a bad idea for any number of reasons. And if the tick is dying slowly, there's the risk that it'll say, I'm dying, I just have to squirt all my pathogens into the bloodstream as quickly as possible because it's my last chance. And you don't want that to happen. So you just want to get the tick off you quickly, cleanly.
So what's next?
Okay, so you get the tick off you. You've got a hole in your skin, so some sort of disinfectant's not a bad idea, as with any other time you get a hole in your skin. You should keep the tick. When I say save the tick, this doesn't mean that I'm trying to preserve the species. Put them in a bottle, a baggie, the freezer, some sort of container. And the reason you're doing that is in case you get sick later. You can send the tick off for testing. This is not available uniformly for free through the medical system. It is sometimes under some circumstances, but mostly it's a commercial service. However, people may want to know if the tick that bit them happened to have the Lyme disease bacteria, yes or no. And that can be either relief or information for you and your healthcare provider to figure out what to do next. You can also take the wait-and-see approach. And the wait-and-see approach is if the tick put in a pathogen, you may well get a short fever because that's how our bodies respond to infection. Can you tell the difference between a mild fever from a flu, food poisoning, or tick bite? Probably not. Short fever is a fever. Yeah. Some people get rashes. Not everyone. People differ in how rashy they are, and depending on what color your skin is, it may be easier or harder to see a rash. And not everyone gets rashes. So fever and a rash is definitely a source of concern, and you should, particularly if you've noticed the tick bite, you should be talking to your healthcare provider about that sooner rather than later. If you do not detect those signs, you may have been lucky and your tick may not have been infected, or you might just not be a rashy, fevery person, and then you have to deal with that. There are, in some areas, you can get a single dose of antibiotic as a preventative. Not entirely clear how well it works all the time. It works better the sooner you've got the tick off you and if you don't wait around. But it, like everything else, it's probably not 100%.
So you suggest seeing a doctor as soon as you can, medical professional?
Yeah, some sort of healthcare provider, depending what you have access to.
Now, when does Lyme disease show up? Or what can you tell me about Lyme disease?
Okay. So Lyme disease is going to happens once the bacteria that the tick is carrying, it sits in your skin for a little bit while the bacteria multiply, and then after a while it gets into the bloodstream and your lymphatic system and travels through the body. Then the bacteria are going to invade various organs, and that's when the problem really starts. So you have the very early stage where it's just in your skin. That responds really well to antibiotic treatment because there are not many bacteria and they're in one place. Once they've traveled around your body, there are more bacteria, they're in more places, and it's a harder illness to treat. Your immune system is also going to be attacking the bacteria and can cause damage to the body while they do that. We need our immune system, but it's sort of there is off-target collateral damage. So Lyme disease is caused by the bacteria, and some of the damage is due to the bacteria, and some of the damage is due to our immune system getting rid of the bacteria. At least in humans, because this is not a bacteria we're particularly well able to deal with, most people need antibiotics to get rid of it. So it won't just go away.
So what are the symptoms of Lyme disease?
Okay, so early stage, transient fever, maybe, rash, maybe. As it spreads, you're going to get symptoms from the inflammation in various parts of your body. So typically, the bacteria likes going into your joints because your immune system can't get it there. So you'll get migratory arthritis. There's fevers, just sort of a general feeling of bleh because you've got an infection and that makes you feel tired and weak. The bacteria could get into your heart, at which point you get inflammation of the various bits of your heart, and that can cause a problem if the heartbeat gets disturbed. Can travel to different organs and make you compromise the function of those organs, and the bacteria seems to really like our nervous system. So if you get it in some of the nerves, one of the typical things you see is Bell's palsy. Sort of, it looks partially like a stroke where you have paralysis of one side of the face or other, or hearing loss in one ear. Not just, your hearing is getting worse with age, but all of a sudden it turns off on one side or the other. That's the bacteria hanging out in one of the major nerves leading to your brain, and then your immune system going after it. If you really leave it, it gets into the central nervous system, so it gets into your spinal fluid and then into your brain. That's really bad. And it just keeps replicating and dividing, and you get sicker and sicker. It is untreated. It goes into a chronic illness, a form that causes chronic illness. It's a debilitating illness, and it's progressive, and it gets worse and worse.
Do you have any idea what percentage of people would get Lyme disease?
If
they're bitten by a tick?
Yeah, that's tricky to say. There are two things that determine whether you get Lyme disease from a tick bite. First of all, not every tick has the bacteria that causes Lyme disease. So if the tick doesn't have bacteria in it, it's not going to be able to give you Lyme disease. Now, it can have bacteria that cause, or viruses that cause other diseases, but Lyme disease is the most common one, and it's the one people worry about most. So if your tick happens, if you're lucky and your tick doesn't have the bacteria, you're good. The other thing that affects it is how long that tick feeds. The Lyme disease bacteria is usually a little bit slow to go from the tick into the person. So if you're getting that tick off you quickly the same day, it probably hasn't had enough time to transfer into your body.
If you look in New Brunswick, are you seeing a lot, or New Brunswick and Nova Scotia, are you seeing a big uptake in ticks and Lyme disease being reported?
Yes, there has been a huge uptick in that. Pun not intended. The official numbers are like any other surveillance. They underreport the issue, and that's because to get officially reported, the person has to notice, they have to find a healthcare provider, the healthcare provider has to think about Lyme disease, then there's usually blood testing, and then the healthcare provider has to fill out a whole bunch of forms. And there's a lot of things that can interfere with that process that goes from a tick making someone ill and it getting recorded. However, if you assume that all those steps happen about the same over time, so it's not much different this year from last year, from the year before, what we are seeing is an exponential rise in the number of cases being recorded. And when we look at ticks, there are absolutely hugely more ticks, and those ticks are going to be biting people sometimes. The other thing we see that causes me a huge amount of worry is when we look, the ticks are just filling up on mostly wild animals. Humans are kind of, well, you've got blood, I'll take you, but mostly they encounter wild animals. And the number of pathogens in the wild animals, particularly wild rodents and some of the shrews, some birds, is increasing. So it's more likely that the ticks are going to be infected, and we're also seeing an increase in the proportion of the ticks that are carrying pathogens. And a greater variety of pathogens. It's not just Lyme disease.
So it's a big, big problem, is what you're saying.
Yes, it is. It is a big problem, and it's going to get worse. Now, that doesn't mean we should just crawl up into a fetal ball and never go outside again. We happen to live in an incredibly beautiful part of the world, and we need to be out there and enjoying it. And for the people who work in the outdoors, you don't actually have a choice unless you want to be unemployed. So we have to deal with the ticks. And if we look at people in southern Nova Scotia, where they've got a huge tick problem, and our neighbors to the south in the New England area, they've been living with ticks for a while. So we can adapt to deal with them. The adaptions are tick repellents when you go outside, and tick checks are a must. So we can deal with this problem. We're good at dealing with problems, but we do have to know that the problem is there.
So I guess to finish off our podcast, a tremendous amount of information you've provided. Prevention, certainly from what you say, is a key. Just maybe worth repeating. What steps do you suggest that people or organizations take when it comes to educating their staff on ticks and what they should do to stay safe?
Okay. So the first thing is knowing there is a problem. So there are prevention things by just telling people that ticks are there and to be aware. When people go outside for work, for recreational activities, bug spray, and start putting it on even before you see the mosquitoes, and keep putting it on in the year after the mosquitoes have died off after the first frost. The ticks are out earlier and they hang on later in the year. So really, if there isn't snow on the ground, be spraying your legs with bug spray. And tick checks are absolutely essential. Children are very much at risk because they are small, so they're closer to the ground, and they're pretty active. And just like mosquitoes, ticks, they don't see that well, but they smell very well, and they smell the carbon dioxide and all the small molecules our bodies exude. So children are very much at risk, and they may not be, depending on their age, they may or may not be into doing tick checks. So that's up to the parent, depending on the child's age. Either you're doing the tick check or you're providing the education that being disabled from a preventable illness is uncool, so doing a tick check is a really good idea. For pet owners, there are a number of products that will save you from potentially losing a dog. And possibly having iller cats. So there are tick and flea meds that work very well. There's a vaccine for Lyme disease in dogs. A vaccine for Lyme disease in humans may be coming in the future at some point, but that's not going to help us in the next few years.
Look, Dr. Lloyd, I'd like to thank you very much for certainly very much the information you gave us this morning. Tremendous amount of knowledge you have when it comes to ticks and Lyme disease. Thank you again. For our podcast listeners, I guess the best advice I would give is, based on our discussion this morning, it's a very serious issue that there needs to be a whole lot more education on, and a lot of prevention steps need to be put in place. Because I'm sure, based on what you've said, Dr. Lloyd, we're going to be seeing a whole lot more of this over the next few years here, especially here in New Brunswick.
Yeah, sadly, yes, but still get out there and enjoy this great province and be safe.
Well, thank you very much, Dr. Lloyd. For our listeners, that's our podcast for today. As always, we appreciate your feedback. You can always reach us at podcast@ssnb.ca. Stay safe. See you next week.